7 days before kidney failure, watch for this silent sign. Every single day, thousands of people worldwide are diagnosed with kidney failure, a condition that can permanently alter the course of their lives. Kidneys are the body's natural filtration system, responsible for clearing waste, balancing electrolytes, and regulating blood pressure. When they stop functioning, toxins build up rapidly, leading to a cascade of health problems. The tragedy is that kidney failure rarely strikes without warning. In fact, research and clinical observations have shown that the body often sends out early signals in the days or weeks before kidneys shut down completely. These signals can appear as soon as 7 days before failure, giving a small but crucial window of opportunity to act. The problem is that most people dismiss these signals. They assume swelling is just from standing too long, fatigue is due to age, or nausea is caused by something they ate. But the kidneys are quiet organs, and when they speak, their voice is subtle. Today, we'll walk through the critical warning signs that your kidneys may give you in the week leading up to failure. Recognizing them could mean the difference between prevention and crisis. This video is for educational purposes only and not a replacement for professional medical advice. If you notice these symptoms, seek immediate evaluation by a doctor. The first sign is swelling in your ankles, feet, or hands. When the kidneys begin to fail, they cannot efficiently remove excess fluid and salt from the body. This causes fluid to accumulate in the tissues, most noticeably in the lower extremities, where gravity pulls it down. Many people first notice it when their shoes feel tight, or when socks leave deep, unnatural grooves around the ankles. It may also appear in the fingers, causing rings to feel tight, or hands to look puffy. This swelling, called edema, is more than a cosmetic inconvenience. It is a loud signal that the kidneys are failing to maintain fluid balance. What makes this sign particularly dangerous is how easy it is to dismiss. People assume their swelling is due to long hours on their feet, high salt intake, or even hot weather. But persistent swelling that worsens day by day should not be ignored. Studies from nephrology clinics have documented that edema is one of the earliest visible signs of advanced kidney dysfunction. If you notice swelling that does not improve with rest or elevation, or swelling that continues to spread, it is essential to consider kidney failure as a possible cause. The second sign is changes in urination. Because kidneys filter waste and produce urine, changes in bathroom habits are some of the most direct signs of their health. As kidney failure approaches, some people notice that they urinate much less than normal, even if they drink the same amount of fluid. This reduction in urine output means waste products are staying in the blood instead of being excreted. Others experience urine that looks foamy or bubbly, which indicates protein leakage, a classic sign of kidney damage. Another frightening warning is blood in the urine. This can make the urine appear pink, red, or even cola-colored, and is a strong indicator that the kidney's filtration barrier is breaking down. Sometimes, people also report needing to urinate more frequently at night, a condition called nocturia. While urinary changes can be related to other conditions like infections or prostate problems, when they appear alongside swelling, fatigue, or nausea, the possibility of kidney failure must be taken seriously. The third sign is shortness of breath. At first glance, breathing problems don't seem connected to kidney health. But when kidneys fail, fluid builds up in the body and eventually collects in the lungs. This fluid overload makes breathing difficult, causing people to feel winded even after light activity or while lying down. Some describe waking up gasping for air or needing to sleep with extra pillows just to breathe comfortably. Shortness of breath may also be worsened by anemia, which is common in kidney failure as the blood carries less oxygen. This symptom is often misattributed to aging, lack of fitness, or even asthma. However, Doctors in dialysis centers consistently report patients describing breathing problems in the days leading up to kidney failure. When fluid begins to press on the lungs and oxygen delivery is compromised, the risk of sudden respiratory distress increases dramatically. If you feel breathless without obvious cause, especially if swelling or fatigue is also present, it's time to consider kidney trouble as the root. The fourth sign is persistent nausea or vomiting. Kidneys normally filter toxins from the bloodstream, but when they fail, these toxins, called uremic waste, begin to accumulate. This buildup irritates the digestive system, leading to queasiness, loss of appetite, and sometimes uncontrollable vomiting. People often describe food tasting strange or unpleasant, and some report a metallic taste that makes eating difficult. The body is essentially poisoning itself from the inside out. What makes this sign insidious is that nausea is such a common symptom of many conditions. People assume it's food poisoning, a virus, or indigestion, and they try to wait it out. But when nausea lasts for days, and especially when it occurs alongside swelling, changes in urine, or fatigue, it should raise urgent concern. Physicians treating kidney failure frequently note that nausea is one of the most common complaints in patients arriving at the hospital. If ignored, it can quickly progress to severe uremia, requiring emergency dialysis. The fifth sign is unexplained fatigue and weakness. The kidneys produce a hormone called erythropoietin, which stimulates bone marrow to make red blood cells. Without enough red blood cells, the body becomes anemic, meaning tissues receive less oxygen. This leads to relentless fatigue, weakness, and inability to complete daily tasks. People often describe it as a bone-deep tiredness that doesn't improve with sleep. Even simple chores like cooking or walking a short distance feel overwhelming. In the days before kidney failure, this fatigue often intensifies. Patients may find themselves sleeping excessively or feeling drained after minimal effort. Studies have shown that anemia of chronic kidney disease can develop gradually, but becomes most pronounced as kidney failure approaches. Unlike ordinary tiredness from stress or overwork, this fatigue is persistent and disabling. If exhaustion begins interfering with your quality of life without explanation, your kidneys may be trying to warn you. The sixth sign is confusion or difficulty concentrating. As toxins accumulate in the blood, they also affect the brain. This condition, called uremic encephalopathy, causes problems with memory, focus, and mental clarity. Patients sometimes describe feeling like they're in a fog, unable to think straight. They may forget conversations, misplace objects, or struggle to follow instructions. In severe cases, confusion can progress to agitation, delirium, or even seizures. This symptom is especially dangerous because it can appear suddenly. Family members often notice before the patient does, pointing out that their loved one seems forgetful or out of character. Neurologists working with kidney patients emphasize that unexplained confusion should never be ignored, particularly in people with known kidney disease or risk factors like diabetes and hypertension. If your mind feels clouded for days on end, it may be because your blood is carrying more waste than your kidneys can handle. The seventh sign is metallic taste in the mouth and bad breath. Waste products that accumulate in kidney failure alter the chemical composition of saliva and breath. This can cause a persistent metallic taste that makes food unappealing. Many patients report losing interest in meals, which only worsens fatigue and weight loss. In addition, a strong ammonia-like odor on the breath, known as uremic fetor, is a hallmark of advanced kidney disease. Dentists sometimes notice these changes before doctors do, because the breath odor is so distinct. While bad breath can come from many causes, when combined with nausea, fatigue, and changes in urination, It strongly suggests kidney dysfunction. If your taste changes dramatically or your breath develops a persistent chemical smell, don't ignore it. Your body may be signaling that waste products are building up in your bloodstream. The eighth sign is muscle cramps. Healthy kidneys help regulate the balance of electrolytes like sodium, calcium, and potassium. As kidney function declines, these electrolytes become imbalanced, leading to painful cramping in the muscles. Patients often experience cramps at night, waking them from sleep, or during light activity when they least expect it. These cramps can be severe, lasting longer than ordinary spasms and resistant to stretching. People often mistake them for dehydration or overexertion, but medical studies have shown that muscle cramps are common in the days before dialysis begins. When potassium levels rise too high, the risk of cardiac complications also increases, making cramps more than just a painful nuisance. If your muscles are seizing frequently without clear reason, and especially if you have other kidney-related symptoms, it is a sign your electrolyte balance may be dangerously disrupted. The ninth sign is itchy, dry skin. The kidneys help remove excess minerals and toxins, but when they fail, phosphorus levels climb and calcium balance is disrupted. These changes cause intense itching that feels deep under the skin. Unlike ordinary dry skin, this itching is relentless and does not improve with lotions or moisturizers. It may become worse at night, interfering with sleep and quality of life. Dermatologists working with kidney patients often note that this itching is systemic, meaning it is felt across the entire body rather than localized. Sometimes it is accompanied by dryness, flaking, or changes in skin color. Itching combined with swelling, nausea, and fatigue is a strong indicator that the kidneys are no longer maintaining balance. If you find yourself scratching constantly without relief, it may be your body's way of telling you that toxins are building up beneath the surface. The 10th sign is chest pain or irregular heartbeat. When kidneys fail, the consequences reach beyond the urinary system. Electrolyte imbalances, especially elevated potassium, can cause dangerous arrhythmias, irregular heart rhythms that may lead to sudden death. Fluid overload also strains the heart, causing pressure and discomfort in the chest. Some people feel palpitations, while others describe a racing or pounding heart. Cardiologists recognize kidney failure as a major risk factor for sudden cardiac events. In fact, many patients with end-stage kidney disease ultimately succumb to heart problems rather than kidney issues alone. If chest pain or palpitations appear in the context of other kidney symptoms, it is a medical emergency. Waiting even a few hours can be the difference between life and death. Immediate evaluation is essential. These 10 warning signs — swelling, urinary changes, shortness of breath, nausea, fatigue, confusion, metallic taste, cramps, itching, and chest pain — are the body's way of pleading for help. They often appear together in the week before kidney failure, forming a pattern that should never be ignored. Sadly, countless patients recall experiencing these very symptoms, only to dismiss them until hospitalization was unavoidable. But awareness can change that outcome. If you or someone you know notices these signs, don't wait for them to get worse. Seek medical care immediately. Blood tests and urine tests can quickly reveal how well the kidneys are functioning, and early intervention may prevent complete failure. Treatments may include medication adjustments, dietary changes, or starting dialysis to remove toxins from the body. Remember, your kidneys are silent workers. They rarely cause pain until it's almost too late. That's why listening to these subtle warnings is so important. Don't chalk up swelling, fatigue, or nausea to minor issues when your body may be signaling something life-threatening. Prevention and timely action are your strongest allies. Thank you for watching and for taking steps to protect your health. If you found this information helpful, type "helpful" in the comments below. Don't forget to like this video, share it with friends and family, and subscribe for more health insights that can save lives. Your support allows us to continue spreading knowledge that empowers people worldwide. Stay vigilant, stay healthy, and always listen when your body whispers before it screams.